You are watching McLaren Port Huron Today's Health Program, and I'm with Pete Girimonte, a dosimetrist at the Karmanos Cancer Institute at McLaren Port Huron, talking about his role in providing radiation therapy for our cancer patients. Pete, thanks so much for joining us today.
Oh, it's good to be here, Kelly. Thank you.
So we have to start. What's a dosimetrist?
Basically, a dosimetrist is a member of the radiation oncology team that does all of the treatment planning for each individual cancer patient. We work closely with the physician and the medical physicist to develop the best treatment plan possible for each patient. The medical dosimetrist has a working knowledge of clinical oncology, physics, radiation oncology, and a pretty strong math background.
Very good. So we had spoken with Dr. Bott previously in another segment, and he was talking about how you all work together as a team. So what is it that you do at McLaren Port Huron to help our patients?
Basically, my main role is to develop the treatment plan for each individual patient. Dr. Bott or another physician, radiation oncologist, will write a prescription, and then I match that prescription to each individual patient's anatomy by getting the intent of the prescription to match the patient's disease process.
Do you work directly with the patient when in this plan, or how often do you interact with the patients receiving?
The only time I truly interact with the patient is on the first day when they come in for their initial CT simulation. I'll be in the CT room with the sim therapist. I will assist the sim therapist in positioning the patient for their treatments, or any immobilization devices that may be needed. And then that's pretty much it, my interaction with the patient on the first day. Now, that does sometimes happen where there could be a question about something and the therapist will call me into the treatment room to check on something or to verify something. But other than the first day, my actual patient-to-patient contact is limited.
So when you were talking about the sim, so this is the simulation looking at the tumor.
Correct.
To map out where you want the radiation to treat and where you don't want it to treat.
Correct, exactly. Every single patient that comes in our department will get what's called a CT simulation, and it's just basically a CT CAT scan, but it's done for our specific needs in our department.
So it really is individual for every single patient, every tumor, everything is different then.
Correct. Oh yeah, everyone's unique.
Yeah, so what resources do you use then to kind of form this resource plan, or this treatment plan?
Basically, obviously the treatment planning computer system that we use, but then also based on all the other resources we use, any diagnostic imaging that the patient has, MRI, PET scan, any diagnostic CT scans. I will take all that information and fuse it and download it into our treatment planning system. And then that gives me a really good picture of what the tumor looks like, what the patient's anatomy looks like, and what I pretty much have to deal with.
We learned a little bit about treatment plans and these national guidelines, so everything has a specific order in which they go. What types of tumors do you tend to see a lot at our Karmanos Cancer Institute here at McLaren?
It's pretty much normal from the patients or the departments that I've used to work at. We see, a lot of breast cancers, a lot of gentlemen with prostate cancers. Seems to be a pretty good population up here that have head and neck cancer, and also lung cancers.
And so, what is your goal then when you're working with these patients?
My basic goal is to get the best plan possible for each individual patient that I could possibly do without causing any harm to the patient. Basically, my job is to get the dose to the tumor, but also spare any normal tissue that would also limit their side effects.
So do you kind of follow, even though you don't interact with the patient other than that first visit, do you kind of follow them to make sure that plan is carried out throughout their course of treatment?
Yeah, during the course of treatment, every patient will get a cone beam CT. It's a CT that's done directly on our treatment unit, and we will look at those daily to monitor the patient for any type of weight loss or anything that might change their anatomy. The biggest thing is, like on our head and neck patients, with the combination of chemo and radiation, there's a strong possibility that they will lose weight. And when they do lose weight, that changes their anatomy, which will obviously change my plan So,
Okay.
so
Because we talked a little bit about how there's like an infrared light that kind of lines up the patient, so that could all change then.
Oh,
based
definitely,
on throughout
definitely,
the course of treatment.
definitely. When a patient does lose weight, it changes things dramatically. That's why we strive to our patients that they keep their weight.
It sounds like a very interesting position and job here. So, thanks so much for joining us.
Thank you.
We do need to take a break, but we will return in just a few moments. Thank you.